Feel free, if I say anything at any point that is confusing, let me know. And I'm looking forward to the questions and discussions at the end as well. So I'm Rachel Fichtenbaum with MassMobility, which is a statewide initiative. It's based in the Executive Office of Health and Human Services for Massachusetts. And the mission is to increase mobility for people with disabilities, older adults, anyone who lacks access to transportation to be able to get around where they want to go. So we do that in two main ways. One is by raising awareness of existing services, which I think is primarily what everyone wants to talk about today. Because sometimes someone is stuck at home and wants to go somewhere, and there actually is a transportation option they could be using, they just don't know about it. Other times, depending where you are and where you want to go, there may not be a transportation option to take you where you want to go at the time you want to go there in the way you want to get there. And so we also work with organizations to help them think about how they can expand mobility or add new options or fill in some of the gaps. So I'll touch on that as well at the end. And we take a community transportation approach, which means anything that's out there in a community that might be able to help you get where you want to go, we're interested in that. We're not a transportation initiative that only focuses on trains or only focuses on buses or is only looking at services that are provided or funded by certain agencies. We're just interested in everything that's out there that might be a good fit for someone or might be an option. And in Massachusetts, what's available for community transportation, it really varies depending on where you are and where you're going. So I remember one time I heard from a family that had just moved 1 or 2 towns over, and they were so surprised that their transportation option that they were used to using wasn't available anymore. And that's just a peculiar thing about Massachusetts, where it really depends on where you are and where you're going. So I'm going to give an overview of what are some of those types of options that can be available in different communities. And then I'll share some tools for figuring out which ones are available to you where you are. So some of the main providers of different types of transportation options in Massachusetts are the transit authorities. It's not the only option, and I'll cover some more later, but I'm going to start with them because they do provide a lot of services. There are 16 transit authorities. The MBTA is the biggest one, and that serves Greater Boston, but there's also 15 regional transit authorities serving different parts of the state. So there's a picture here of a map of Massachusetts. Many, but not all towns are shaded in different colors. A town that is shaded in is a member of a transit authority. So there are a few towns that are not a member of any transit authority, but most towns do belong to a transit authority. But even within a transit authority, even if you're a member of a transit authority, not all towns get all the services. So again, it varies depending on what town you're in. There's a website here where you can go and find a list of all the different towns and which transit authorities they're members of, so that if you're not sure what transit authority you're in, you can find yours. And then I'm going to say a lot of times, like, and then you can go to their website or you can call them to find out what's available to you, because it does vary town to town. But all transit authorities provide 3 different types of services, which I'll explain: fixed route, paratransit, and other services. So fixed route, you can think of it like a bus. Basically, it means that the route is set in advance. There's a map that'll show you where it's going to be. There's a schedule, so you know approximately when it's going to be there. And it's not restricted by eligibility, so anybody can ride. Some things to know: if you have a disability, you can apply for a transportation access pass to get a discount to ride the fixed route. So if you are interested in riding the bus or subway and want a discount, you can check out your transit authority's website for how to apply for the transportation access pass. If you're interested but have some questions or concerns about using fixed route transit, you can see if your transit authority offers travel training. Travel trainers are professionals whose job is to help people with disabilities, older adults, or anyone else learn to ride the bus or subway safely and independently. So for example, if you wanted an introduction to how to use certain accessibility features before you have to just get on in the moment, that's something a travel trainer could help you arrange and show you how they worked and practice. Another type of service that transit authorities offer is called paratransit service, which is also called demand response or dial-a-ride. It has a lot of different names. This is service that is origin to destination. So it means it comes to you where you're starting and it takes you to where you're going. So whereas for the fixed route, it has its route that it always goes the same place. For paratransit, the route varies day to day. It depends on where people are requesting trips and where they need to go. So transit authorities are required by federal law to provide this under certain circumstances. The Americans with Disabilities Act of 1990 says that all Americans should have equal access to the mobility that public transit provides. So if there's bus service, but I have a disability that prevents me from being able to use that bus, I have the right to have equal access to go where that bus would have taken me if I were able to ride it. And so what that looks like is transit authorities are required to provide origin to destination service within 3/4 of a mile of where they have bus or subway service during the hours that bus is operating. So this is the ride in Boston. It has some other names in other parts of the state. But if you are starting your trip and ending your trip within 3/4 of a mile of where you could have taken the bus, and you have a disability that prevents you from being able to take the bus, then the transit authority is required by law to provide this service. You do have to apply for eligibility, and that eligibility is not based on a diagnosis. It's based on, does your disability prevent you from being able to use the bus some or all of the time? And so that's a process. You can find out how to apply on your transit authority's website. And then if you are found eligible, you do generally have to reserve your ride in advance. So, if you suddenly get a hankering for some ice cream, it's probably not gonna work out, but you can say, okay, I really think on Wednesday I'm gonna want some ice cream. Let me, request my trip in advance so that I know I'll be able to go to the ice cream store on Wednesday. Kind of early in the morning for ice cream. I don't know why I thought about ice cream. Oh, and I wanted to say, federal law requires this within 3/4 of a mile of the bus, but transit authorities, some of them can do more than that. So some of them don't just offer it within that 3/4 of a mile, but have some additional service, and that varies by transit authority. And then other services. Transit authorities also offer additional services. So, for example, a number of the regional transit authorities in Eastern Massachusetts offer a long distance medical shuttle into Boston. So I know a few people mentioned medical appointments downtown. Depending where you are, the transit authority may offer something that will either pick you up at your house or pick you up closer to where you are, so you don't have to get all the way into the city, and then drop you off. And they all work a little differently. Some of them, you just tell them where you need to go and that they'll add that to their list. Others of them have like a pre-approved list of different facilities that they go to. There's I guess I didn't put this. If that's of interest, I can share. I have them listed on a website, and I can share that. So I can put that in the chat after the presentation. Or again, you can find that information on your transit authority's website. The other thing, and this is, I know Shannon, I think, had asked sort of what's new in transportation, what's been changing. And I'd say the latest hot new thing is on-demand service, which means that you don't have to reserve in advance. So you can go get that ice cream in the moment when you want that ice cream. And this is very new. So transit authorities are still playing around with how to offer that and figuring that out. So a few examples, the ride for the MBTA service area, if you are eligible and signed up for the ride, so that's the paratransit service, you can sign up for a pilot they have where you can get a set number of subsidized Uber or Lyft trips each month. So that allows for the in the moment service. There are sometimes a limited number of wheelchair accessible Uber and Lyft options. So another way that transit authorities are experimenting with offering on-demand service is called microtransit, which is when it's on demand. So it's really similar to using Uber or Lyft, but it's the transit authority providing the service. So it's not through the companies Uber or Lyft, it's not Uber or Lyft drivers, it's transit authority drivers driving transit authority vehicles. And so it's much easier for transit authorities to set that up so that the vehicles can be wheelchair accessible, the drivers have more training. So some examples are Gatra Go, which is some on-demand service in different parts of southeastern Massachusetts, and then FRTA Access, which is in Franklin County. So not the town of Franklin. The town of Franklin is actually in the Gatra service area, but Franklin County, so out by like Greenfield, they're piloting a microtransit service, and some others are as well. Really, it's like every month it seems like there's a new microtransit pilot coming. So that was some of the different services that transit authorities offer in Massachusetts. But as I said at the beginning, not every town is a member of a transit authority. And even within a transit authority, not all towns get all of those services. So what else can be out there? Some towns offer municipal transportation options. So for example, in Lexington, they have the Lexpress, which is a bus service that serves Lexington and connects to some neighboring towns. And it's not offered by the MBTA. It's in addition to the services that they get from the MBTA. It's just a bus system run by their town. Councils on Aging, quite a few of them have vans and operate van service. And some of them open that van service to people with disabilities of all ages, in addition to older adults. So if you're looking at transportation options in your area, I always recommend reaching out to the Council on Aging, find out who's eligible for their service. And also they are often sort of thinking about a lot of these same things. They're helping older adults who may be retiring from driving. So they may also just be generally aware of some of the different options and services that might be useful to you. Then there's taxis on-demand service like Uber and Lyft, which we talked about, though all of those can have a limited supply of wheelchair accessible vehicles. For longer trips, intercity bus like Peter Pan or the P&B bus, DATCO, the commuter rail, even Amtrak for certain trips. And then if you're going to work, you can see if your employer is a member of a Transportation Management Association or a TMA, which is when employers get together in groups to help think about employee transportation. Or sometimes employers also offer other transportation services to their employees. And Caitlin and all are going to share these slides, so you'll have them and all the links. So there's more anything I'm talking about, there's more information on my website. So in addition to asking questions and the conversation that we'll have after this, there's also more information online. And I'm also going to share my email in case questions come up later. So that's an overview of what are some of the different types of transportation service available in communities. But then, of course, the question is, but what's available to me in my community? And it can be really confusing to try to figure that out. So a really helpful tool is RideMatch. And if you're just getting started, this is where I would recommend that you start for figuring out what's available in my town. So RideMatch is an online searchable database of public and private transportation options. You can search it in two different ways. You can either select your town from a drop-down list, and it'll give you a list of transportation options serving your town, or you can use the trip planner. So you put in where you're starting, where you're going. You can check off if you're traveling with a wheelchair or need some other common types of accommodations. And then you'll get a list of the public and private transportation options that can do that trip. And they try to arrange it so that the cheaper options come up first. So it starts with public transit, then you get subsidized options that might be offered by towns or councils on aging, nonprofits. And then you get private services like taxis and livery at the end. These days, sometimes people ask me questions about COVID-19 and safety end transportation. And so I wanted to just touch on that briefly as well. Basically, over the transit authorities and also other transportation providers as well have been providing some transportation the whole time. And so they've learned a lot about how to do it and what works. And they are taking steps to promote safety. And the pace of change has definitely slowed down since the beginning. But I think if you are going to try an option that maybe you were using before the pandemic and you haven't used it for a long time, it's worth checking to see if there's been any operational changes, if they've made any changes to the schedule or anything like that before you get too far along in your planning, just to make sure. In terms of specific safety protocols, it depends on your transportation provider. So you can check their website if you're wondering exactly what are they doing to stay safe. Or call them if it's not there on their website. But some of the different types of things that providers are doing include being careful about how many passengers are riding at the same time, taking steps to maintain distance between passengers, as well as distance between passengers and the driver, asking the drivers to wear masks and use PPE, and asking passengers to do that as well when possible. Ventilation, keeping windows open, making sure new air is coming into the vehicle instead of recirculating the same air. Cleaning in accordance with CDC guidelines, and sometimes health screening and attestations as well. And the American Public Transit Association put together some materials just sort of emphasizing what are transportation providers doing and what can riders do so that together we can all keep each other safe. So that's the overview of kind of what does the landscape look like in Massachusetts. But I also wanted to touch on the second part of what MassMobility does, which is think about what can organizations and others do to fill in some of those gaps. And we have a webpage also on sort of what can individuals do, or how can individuals tap into local advocacy efforts or groups that are working to fill in some of the gaps. So there's some pictures on this slide. There's a group of older adults who are part of a senior center in Boston who advocated together for a safer crosswalk because the cars would go really fast right outside their senior center. There's also some older adults doing a walk audit, thinking about like what in their area is good for walking or for using a wheelchair and what they need to advocate for improvements to make it a safer, more comfortable place to walk. And then the Don't Just Sit There sign is from a group of advocates that have gotten together in the Worcester area, and they're uniting 3 different groups into a coalition. There's a group of people who ride the bus, a group of people who ride paratransit, and a group of people who were advocating for more wheelchair accessible on-demand transportation options. And they've all sort of created a coalition together so that they can support what each other are advocating for and all advocate together. And then I like to share a few examples of ways that different organizations have found to expand mobility, just as like an example of what it can really look like to find ways to fill in the gaps. So the blue van is from SCM Elderbus, which serves 21 towns sort of in the southwest of Worcester area. And they realized that in 4 of their towns, they always had extra capacity. They were already driving vehicles around, paying for the drivers and the insurance, and they had space. They could carry more people. And so they ended up easing their eligibility restrictions. So they had only been allowing older adults and people with disabilities to ride, but in those 4 towns, they started allowing other people who didn't qualify but needed to get to work to also ride. And so just by changing their eligibility restrictions, they were able to help more people and get them a ride to work. Then at the bottom, there's the Quabog Connector, which serves 9 towns based in Ware, Massachusetts, so kind of halfway between Worcester and Springfield. And that was created by a group of nonprofits partnering with the town of Ware. They were kind of in between transit authority districts, and they really had very little service. But people needed to get places and couldn't afford a car or didn't have access to a car. And so they created it's basically like public transit. It's just not run by a transit authority. It's open to the public with priority for people with disabilities and older adults and people who need to get to work. You call a couple days in advance. It's demand response. It comes to you and takes you where you need to go within that service area. And they're also looking at maybe adding a bus along Route 9 at some point. So that I wanted to highlight that in case anyone lives in that area, that's another option in addition to public transit or in addition to transit authorities for getting around. And also because it's an example of organizations getting together to fill a gap. And then the last one, the accessible livery on Cape Cod. This is from almost 10 years ago. So before Uber and Lyft were on the scene. And the Cape Cod Regional Transit Authority, they kept hearing from people that there was no wheelchair accessible taxis on Cape Cod. And so they got a grant and they partnered with a nonprofit and they created an accessible livery program. So it's like an accessible taxi, except you can't hail it from the street. You have to call it. And they structured it so that the cost would be about the same as a taxi. Yeah, so I included a few more links in case you're interested in thinking more about advocating or how to expand service or fill in the gaps. But I think at this point, I'm interested in your questions and conversation. So thank you so much.
Thank you, Rachel. That was really informative. I just made a note about the travel trainer. I had no idea that such a thing existed. And I love that because I think that it's a daunting task sometimes for people to figure out, how do I get from here to there to the next place and back safely by myself, maybe trying to navigate that with a wheelchair. So I love that somebody can kind of walk through what that process looks like so that it's not just, all right, we're going to play it by ear. We're going to figure it out and hope for the best.
Yeah,
so
absolutely.
I'm really happy to know that exists out there for someone. For those that joined during this, this is being recorded. I will definitely send out the slides, this presentation to you. But if you want to share with us either in the chat or everybody's muted, if you want to unmute yourself and ask questions, if you want to tell us where you're located and what kind of transportation you're currently using, and maybe some questions that you have about transportation options. If there was anything that you want maybe Rachel to touch more on about opportunities in your area or how to get involved or how to use that website to really figure out where it is that you need to go to get from A to B. Seeing if anybody's raising hands, but feel free to use the chat if you'd like to do that.
Just speak. Can I talk?
Yeah.
Okay, it's Jean Tierney. I got on late because I had other phone calls going on.
That's
I'm sorry
right.
about that. I'm interested in the travel trainer mainly because I'm getting my wheelchair this weekend, I believe, and I'm kind of scared about the idea of going out on my own. And so I wondered how, what I would have to do to hear that information again, because I missed it.
Sure. What, that's great. I just put a website in the chat that has contact information for all the different travel training programs that we have. That's the good news. The bad news is that not every transit authority has a travel trainer on staff. So if you're willing to share what region you're in, I could tell you if there's a travel trainer.
I don't know the region. I know it's Rentham, Mass. I live in.
Oh yeah, GATRA has a travel trainer.
Okay.
So I can put her. Let me find her contact information.
And I can send you, I just made a note and I'm going to email you the presentation and the links are inside the presentation. So
thank you.
Once you receive that, you can use that. And if you have any other questions after that or from looking at the presentation, feel free to email me back. And if we have questions for Rachel, we can reach out to her directly.
Okay.
Any other questions? So I live on the Cape, and I constantly see people. So there's a fixed route down Route 28, which is very popular. There's a lot going on, a lot of shops. We have a lot of a summer crowd, but those of us that live and work here year round, some people like to use public transportation, which is so clean, and in the summer has air conditioning, and I love it, especially if I'm getting from, I live in the Yarmouth area. So from here to, if I wanted to get to Provincetown, which I love, and maybe I don't want to sit in that kind of traffic, there's a few stops on the way, and it's nice to be able to meet people on the bus, but you can stand along the route and wave your hand, and they'll stop for you and pick you up. And I think that's great. I think that a lot of different areas are doing that within that fixed route area. Like Rachel had mentioned about that 3/4 of where the stop is. And I see a lot of people, they're not located at a stop, and it might be a little too far, but they know that the bus is going to go along that way, and they just stand out there and raise their hand, and I love it.
Yeah, that's a great point. Thanks for sharing that. It's a number of the smaller transit authorities outside of Greater Boston. It's called a flag stop, and it basically means that either anywhere along the route or in certain places where it's safe, you can flag the bus down. So you don't have to go to a set stop, because they know that, the stop might be really far from you, and why should you have to go all the way to a stop? You can just go to where the route is, and just like Caitlin was saying, flag it down.
Because sometimes it's not ice cream for me. It's, hey, I want to go to P-Town. There's something going on in P-Town. So, and it's air conditioned, and I don't have to be the one driving with my foot on the gas and my foot on the brake. And, that's nice for me. But I'm really thankful to know that there's safe options. There are actually a lot of transportation options available in the state. And I'm not sure about other states, but I feel very thankful that we're in Massachusetts, and to have so many vehicles that can accommodate somebody with a power wheelchair. And they're clean and comfortable. And, some people that don't utilize these transportation options might not understand how safe they really are. And I can understand the hesitation, but I've used a lot of transportation in the state and feel very comfortable with it. And I think that the people that work in this industry are willing to accommodate too. So, don't be too fearful. I know that it's something new. All right. Tony's asking, how do I contact the ride? Are they wheelchair accessible?
So the ride is definitely wheelchair accessible. Not all of their vehicles are, but if you need a wheelchair accessible vehicle, they make sure to send you a wheelchair accessible vehicle. And that is there's an eligibility process. So you have to sign up, you have to apply for eligibility, and it's based on whether you have a disability that prevents you from being able to ride a bus or subway. So that's a little confusing. If you live in Sharon, right, there's no bus or subway in Sharon. So it's confusing, but it's just a little weird. It's basically, the idea is that if there were a bus or subway, you would use that. But then if your disability prevents you from being able to ride the bus or subway, you would need this other service. Now, Sharon is weird. The MBTA offers the other service, even though they don't have the bus or subway. So it's very confusing. But I will put the information for how to apply for the ride in the chat.
Thank you. I think another rule of thumb is just talking about planning for a ride. If you know that you have an appointment somewhere, the sooner the better to make that call and to set that up if you need door-to-door transportation. I understand if an appointment became available, I would say rule of thumb, at least 2 days in advance. Most of these places are willing to accommodate, especially now with COVID. A lot of these are underutilized at the time. Some people aren't using the public transportation because they are using other methods right now, but I can say comfortably that they are taking CDC precautions. Things are clean and distanced. And who wants to sit in traffic? You can be on a bus and making friends with strangers.
Thank you, Caitlin. And one other service I didn't talk about, although Shannon had mentioned it, is Mass Health transportation. So if you're on Mass Health and you can't get to your doctor appointment, if your doctor appointment is for if the doctor is registered with Mass Health and the appointment is a Mass Health covered service, the PT1 form is for getting transportation to those medical appointments. So if that could also be worth looking into. And I think one of the first steps can be to call Mass Health customer service to just make sure that your type of Mass Health includes the PT1. And then what happens is your doctor fills out the PT1 form, and then you're able to call and request rides to your appointments.
Yes, and if you have Mass Health and you're interested in the PT1 and just have a couple of questions for us or need help getting that going, you can ask myself or Shannon or Melissa to help you with that process. It's very simple. Once you have it, you have it. And I think that that's a great thing if you are eligible for Mass Health to get that, because it'll help you to get where you need to go. Tony's asking, what is the PTA program?
Tony, do you mean the PT1 that we're talking about now? Is that the same one?
Yes, the PT1, because I logged in a little late. My apologies.
Oh, no, and I didn't actually talk very much about it. So it's a great question. So it stands for Prescription for Transportation. So basically the idea is that Mass Health understands that getting to your medical appointment is part of your healthcare. And so part of the healthcare coverage for a number of different plans within Mass Health includes a ride if you don't have access to get to your medical appointment. And so if you're on Mass Health, you can contact Caitlin or the other people in the chapter, or you can call Mass Health customer service to find out if transportation is part of your healthcare coverage. And if it is, basically what happens is you talk to your doctor, you say, I need transportation and I have Mass Health, and the doctor says, okay. And they fill out the PT1 form, which it's the prescription for transportation, but basically it's just the form that Mass Health requires them to fill out. It includes your address where you're going to be starting your trip and the address where the doctor is, where you're going to be going. And then that gets approved. And once that's approved, when you have an appointment, it gives you the phone number to call and set up those trips. And that's provided free.
And it's a very simple process. So don't be intimidated because Mass Health is involved. It's very easy for your doctor to fill that out. And I am sure many of your physicians or neurologists or any of the people on your team have done hundreds of these. So utilize it. It's there. Jeffrey is asking, my dad is ventilator dependent in addition to being in a power wheelchair. Does that impose any additional restrictions on which transportation options are available?
Great question. I think if you're working with like a transit authority or like the PT1, then no, like they're very used to different accessibility features. If you were using like a smaller service, a council on aging, it would probably be worth checking in to make sure before the ride shows up. And even I think whenever you have a question like that with a particular transportation provider, when you're setting the trip up or researching options, you can always just ask and make sure it's possible. They might say, oh, we'll just add that to your record so we know to send you the right vehicle or that sort of thing. I don't know if anyone else has anything to add on that.
Yeah,
question.
I think that's a great question. And again, if we didn't know to ask that question, we wouldn't know. And I wonder if anybody on here has any experience with that, with traveling, with having to plan for something like this and accommodate this in addition. The form, yes. So the PT1, a doctor, it's like a prescription. So the doctor would handle that. And if you happen to need us to make the call for you and request that through your physician, we would be happy to do that. Anybody on the care team would be happy to do that for you. These are great questions.
Yeah, there were some questions earlier on. I answered some of them in the chat, but how do we find out who our transit authority is for a given town? If you want to ask me right now, you can tell me the town and I can tell you, but I put in the chat a website that has all the transit authorities listed with the towns. So you could pretty easily, like, if you have like the find on this page, you can put in your town and it'll go right there, or it's regional. And then this was a really good question. I don't know the answer. Do any rental companies offer single day or short-term rentals of wheelchair accessible vehicles? I would love it if anyone else has experience with that here on this call to hear about that, or it's something I could look into.
I actually have a document that I will share in a moment. I want to make sure I get to the chat. What if you have several doctors in different places with the PT1? I have worked with people in the past who that has been accommodated with the PT1. I don't think that that's an issue. It hasn't been an issue for anyone that I've worked with. I don't know if Rachel has any other guidance for that.
Sorry.
If you have several doctors that you're working with and you need to use that PT1 to get to different appointments, different locations, I have not personally had any issue with that.
You need a PT1 form for each location, but it's not hard to get that. It's just, they do need to have a form on file for each address. Yeah, sorry, I was looking at Acton. Acton is a great question because Acton is a very proactive town about transportation. So they have done a lot of work to make more transportation happen in Acton. So Acton is a member of the Lowell Regional Transit Authority, but they actually sort of added their own local paratransit service, which is called the Minute Van. And they even for a while, they had their own fixed route bus going around town, the Cross Acton Transit, although I think that is suspended for the pandemic right now. But I can put in the organization that organizes that for Acton and some other neighboring towns is called Crosstown Connect. And I can put their website in the chat also.